ones that are imprinted in my brain as like my trauma that's stored back in my head aren't ones that we've lost. It's ones that either have a really messed up situation, because there's worse things than death. It's when we keep someone alive past any meaningful life. And those are the cases where I'm just very saddened by, because we see it often with older patients when they're very ill, very sick, and there's something, it's advanced directives, and it's your choice. You and me can make this today with a lawyer or our doctor, and it's, how do I want to be saved? If I have a heart attack right now, do I want to have compressions done on me? Do I want to be intubated? Do I want life-saving medications? Or do I want you to just make me comfortable and let me pass? And what we see often with older, like 90s, 95, 99-year-olds, is that their family just can't let go yet, and they make them full code, which means that you do everything that Western medicine has to offer to save their life. And me doing chest compressions on a 99-year-old little grandma and giving her all these life-saving medications like epinephrine, and we're giving her magnesium and all of these things, like, yes, she technically is alive right now because she has a heartbeat and a blood pressure, but we also just gave her more epinephrine than anyone should ever have in their body at once. And we know that she is probably going to pass away in the ICU tomorrow, in an hour, whenever. And to us, it almost feels like torture at times, because we know that they're not going to survive, but we have to, by law, do everything that we can so that they do survive, at least while they're in the hospital. And that's hard. Those are hard. Yeah.
Let me ask you something about fentanyl. This is for my own personal reasons, but it'll be interesting for the audience, I think. When somebody dies of a fentanyl OD, it's a peaceful death, right? They're not like they're not going through pain. They're not horrified. They're not going through some horrific OD.
So with fentanyl causes something called respiratory depression, and normally we breathe 18, 16 to 20 breaths per minute. That's normal standard. With a fentanyl overdose, your body just starts breathing less and less times per minute until it stops. It's not painful. It's
a peaceful way to go.
It's a peaceful way to go.
Yeah.
And the hardest part is when we get them back. And now they're gonna have that pain of the chest compressions, et cetera, et cetera. But if it's just a standard overdose for the fentanyl, it's usually pretty peaceful.
How long is it before they're gone? Like you can bring them back after some period of time. Like I found my girlfriend in a cold bathtub, hard, blue lips, stiff.
Okay.
There's no bringing that person back.
No, it's stiff as a rigor mortis. It's once the body is stiff, unfortunately, there's nothing we can do from a medical standpoint. But with like the fentanyl overdoses, if it's happened within the last 20, 15 minutes, there's a chance. We've done codes for 5 hours. Before codes, meaning like we're doing compressions and giving medications, et cetera. We've done them for 5 hours, 6 hours on an overdose before because the patient's younger, and we've gotten them back.
You have.
But what kind of a life did we get them back to? Because they've been brain dead for 6 hours, 5 hours.
So there's brain damage.
Most likely brain damage. And are they alive because we have so many drugs in their body right now? Or are they alive because we performed a miracle and now their heart's gonna function on their own? And most likely not. It's the drugs that are in their system. And with most of these patients that we work on for a long time, once they get up to the ICU, they typically don't last much longer. But straight overdose, it's peaceful. They don't know. There's no anguish in that moment. They just slip away.
Yeah. I'm surprised, and I don't want to give anyone any ideas, but it seems like fentanyl is such a dangerous thing, substance, that it could be sprinkled on a place where people are eating food or touching doorknobs or doing all kinds of
My biggest fear is when we get an overdose patient who is now stable, we've placed them to the behavioral side of the hospital, into the unit, and we have to take off all of their clothes to make sure that they don't have any more drugs or weapons on them. Even though they get wanded by security, we still need to double check. My biggest fear is that when I'm taking off someone's clothing, I get a puff of powder or whatever onto my face. And even though I'm wearing a mask, it can go through my eyes, skin.
You're still breathing.
Yeah. And there was that video a few years ago when the police officer, he was going through a patient's suspect's things, and you see it on video, something touches him, and he goes into a seizure. And it turned out to be fentanyl. And that's my biggest fear at work, is that I get accidentally hit with some kind of substance and it turns out to be fentanyl and I die. Luckily, I'm in the emergency department and hopefully my colleagues saved my life.
Yeah.
But that's still one of my biggest fears, is just getting hit with something and having an overdose, or now it's like, now there's fentanyl in my system or whatever, cocaine. Biggest fear.
Let me ask you one last question, Igor. What would you say is the most important thing you've learned through doing this kind of work?
Man, the most important thing is just to cherish your relationships and your friendships, because like I mentioned earlier, you don't know what your day is going to look like. Like I said earlier, I can die right now, leaving this space. I can pass away. And it's like in my life, I like my mother, my grandmother. So ever since I became a nurse, it's always like, I call my grandmother every day. I call my mother every day that I can. I have a half brother. I talk to my brother whenever I can. He's 19, he doesn't want to talk to me. But I talk to him whenever I can. And it's just to cherish those around you, because at any moment they could be gone. The most kind of pain that we feel in this profession is when we are actively trying to save someone's life and their family members watching. And it's normal for the family to watch us attempt to resuscitate. And the worst noise that's imprinted in my brain is the sound of a mother finding out that her son has passed away. And that shriek, that scream, it is the most horrible thing I have ever heard in person. And I will remember that noise for the rest of my life. And it's her, to this day I remember this, it's the doctor came out and spoke to her, and he walked her to the bed where the body was, and he told her that we did everything we could, and we just couldn't save her son. And just horrible. And it's just cherish your loved ones, cherish your friends. That's the biggest thing I've learned from this job.